Hi, my name is Dr. Danielle Crane. I'm a clinical psychologist. I'm making some shorts on what to expect in therapy, and this one's on timing. So it's important to make sure that it's the right time for therapy for you. So if things in your life are really unstable, for example, you're homeless, or if you are struggling with substance misuse to the point where you wouldn't be able to attend a session sober, or if actually you're just not motivated to work on things at the moment and it's more other people that are pressuring you into it, then it's probably not the right time for therapy. And it's really important that we have that conversation with you at, a referral or assessment, because therapy is not going to be effective unless it's the right time. And sometimes it's better to wait until it is the right time to start those sessions. When you get to the point where you do start therapy, it tends to take place weekly. The sessions tend to be 50 minutes to an hour in length. There are some exceptions to that. So there are specific types of therapy where you might have an hour and a half session instead. For example, family therapy, you need longer sessions because there are more people there and everyone needs a chance to talk. For therapy for dissociative identity disorder, you want to have a longer session so that there's half an hour for them to properly ground themselves before they leave the session. And similarly with EMDR, sometimes you will have an hour and a half to make sure that you have time to properly process that particular experience and time to use the resources at the end of the session. I do recommend that you try to give yourself time after the session to use any skills or to reflect on what you've discussed or just settle yourself, rather than going directly into looking after your kids or attending a work meeting or that sort of thing. So try and think carefully about actually what time of day is going to suit you. We are quite boundaried about session times. That's partly because we don't want to be late for our next client, but also because having those boundaries helps people to feel a bit more contained and a bit safer. You can leave the session at any point. You can have a break, you can go to the toilet, you can end the session early. So do feel free to have that conversation with your therapist if needed. We don't want people to feel like they're obliged to stay for the full hour. You are there voluntarily. So I hope that's helped clarify a bit in terms of timings of therapy sessions, and good luck with your therapy.